Hello, my name is Alicia Alamont, and I'm a student at UTSA in Contemporary Biology. Today, our group will be discussing the rise in maternal mortality rates in the United States. We collected our data and information from the World Health Organization, the Center for Disease Control and Prevention, and the Association of Obstetricians and Gynecologists websites. So, first, we're going to define what maternal mortality means. The World Health Organization defines maternal mortality as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So if a woman dies because she is pregnant or because the pregnancy made a condition she had worse or because there was an error in the care of her pregnancy, this would be a maternal mortality. The CDC actually extends this time up to a year after the termination of pregnancy. Also, the CDC began the pregnancy mortality surveillance system in 1986 to actually monitor the rise and the rates and the causes of maternal mortality in the United States. And they found that the pregnancy-related deaths have increased from 7.2 deaths per 100,000 live births in 1987 to 16.9 deaths per 100,000 live births as of 2016.
Hi, my name is Kristen Herrera. I'm a life and health science major for pre-nursing, and today I'll be discussing the causes of maternal mortality in the U.S. The U.S. has the highest and only rising maternal mortality compared to any other industrialized country. Out of every 100,000 births, the U.S. has 7.2 deaths compared to Canada, who has 7, and Greece, who has the lowest of 3. Between the years of 2011 and 2016, the PMSS collected the main causes of maternal mortality, and they included 11% being due to hemorrhaging, which is the bleeding from a vessel, 12.7% being due to infection, 11% being due to cardiomyopathy, which is the failure of the blood to pump blood to the rest of the body, 9% being due to embolism, which is the blockage of a blood vessel, 5.6% being due to amniotic fluid embolism, which is when the amniotic fluid reaches the mother's bloodstream, causing a heart attack and respiratory failure. 6.9% being due to high blood pressure, preeclampsia, and gestational hypertension, or HELP syndrome. 15.7% being due to other cardiovascular syndromes.
Hello, my name is Kristen, and I will be discussing the groups who are most at risk and the issues with the data collection of maternal deaths. According to the data collected by the CDC from 2011 to 2016, the most at risk for maternal deaths are Black non-Hispanic women with 42.2 deaths per 100,000 live births, Indian Alaskan Native non-Hispanic women with 30 deaths per 100,000 live births, and Asian Pacific Islander non-Hispanic women with 14.1 deaths per 100,000 live births. Hispanic and white women have the lowest risk by less than 13 deaths per 100,000 live births. Other at-risk mothers include those with diabetes, hypertension, and chronic heart disease, which can be exacerbated by pregnancy. One of the main issues regarding maternal mortality in the United States is that only 48 states, plus DC, have pregnancy-related codes on their autopsy certificates and are then sent to PMSS for review. There is also an issue with this system, as an autopsy on a female who had been pregnant within a year of her death that was not caused by an accident, homicide, or suicide will be coded as pregnancy-related mortality even if this is not the case. There needs to be a nationwide maternal mortality reporting system in order to identify and remedy the issue.
Hello, my name is Hillary, and I will be talking about what the American College of Obstetricians and Gynecologists is doing to decrease the amount of maternal deaths. The college has come up with 4 initiatives to combat the rise, and the first is a program called AIM that assists states and hospitals in implementing the best practices to treat the common pregnancy-related emergencies, improve quality, and patient care. On the long run, this helps communities close the gap in health care and access to care. The second is optimizing postpartum care by recognizing most maternal deaths occurring the week or month after childbirth. The initiative ensures that women are receiving the appropriate care during and after. The third is the levels of maternal care, which is to ensure that women at risk are given the appropriate maternal care to prevent death. And the fourth is the birth registry, which is a proposed strategy that collects national data surrounding labor and delivery, which helps providers and hospitals understand the overall quality their facility is giving and being able to compare it to national benchmarks. So these are the four steps or four major initiatives that the American College of Obstetricians and Gynecologists has done to combat the rise of maternal mortality.